Hi, everyone. My name is Allison Biedron, and I'm the Health Equity Network Coordinator here at the Institute of Health Equity. Thanks so much for joining us today for this webinar, which is on understanding health inequalities in left behind neighborhoods. And so this is coordinated by one of our fantastic administrators on the network, Paul Baggley. So I'm not going to speak too much, just a bit of housekeeping. We do encourage you to keep your cameras on and your mics off just for the presentations part of the first half. Would be about 30 minutes. And then the second half, we'll open it up for questions and discussion in which we encourage you to come on screen and to unmute yourself and to speak aloud. But you can also put your questions in the chat, and Paul will be fielding those questions as the presentation goes along. And if you're unable to speak, no problem. So any questions that come up, feel free to send me a message in the chat and I can troubleshoot if you're having issues with anything. But without further ado, I'll hand over to Paul. Thanks so much for coordinating this today.
Okay, everybody, I mean, welcome and thanks for giving up your time this afternoon. Before we start, I would just like to spend a few moments explaining how this webinar came about. As Alison mentioned, I became an admin for the Health Equity Network as a volunteer. My background is in sport and physical activity. And so I had a particular interest in Marmot 5, which is to create and develop healthy and sustainable communities. It's important to understand that people on low incomes are less likely to take part in sport and physical activity, and they're unlikely to move out of their immediate neighbourhood when they do take part. And there are a lot of reasons for that. Also, to do sport and to be physically active, you need two important things. Firstly, the space, parks, playing fields, and suitable buildings. And secondly, organisations to make it happen. You know, clubs, community organisations, and in some cases, paid coaches. The first two webinars I organised looked at the work of Professor Louise Mansfield, Professor for Sport, Health and Social Sciences at Brunel University, and Sam Pluck-Rose-Oliver, Policy and Public Affairs Manager for Locality. Professor Mansfield looked at what she called the social movement approach to increasing physical activity, which was community-led and community-driven. And Locality's research considered the importance of neighbourhood-level coordination. Both stressed the importance of cultural competence. That is, considering what worked for the local community in their particular setting. So we were talking about hyperlocal. So this left us with the unanswered question of if we're to apply Marmot principles at neighbourhood level, where are they and how do we identify them? So this is the third webinar, which looks at how we can use the data that's already out there and being recorded to identify areas of perhaps just a few thousand people. So if I may, I'm going to hand over to Katie Leach of the OCSI, the Oxford Consultants for Social Inclusion. So it's over to you, Katie.
Great, thanks, Paul. So hi, everyone, I'm Katie, and I'm part of the research team at OCSI, Oxford Consultants for Social Inclusion. And yeah, I'm just going to give a quick introduction to OCSI and who we are. So we support organisations to use data better to make better decisions. And this has come in all different forms over the years. So on one side, we're a consultancy and we run bespoke projects with clients. And some of the more high profile work includes the English Indices of Deprivation, which we have updated on behalf of government in 2015 and 2019. And we're currently working on the next iteration of the indices as well, which is due for release at the end of 2025. Over the last 4 years or so, we've also worked closely with local trusts to develop a quantitative measure of left behind neighbourhoods. And this is what the webinar is going to be about, so you'll hear a lot more about this later. We also build products that help put all of this data back into the hands of the end users. So it's a focus on keeping things easy to use and intuitive. So it's not just the data analysts that can explore what is going on in a local area. And Local Insight is our mapping and reporting platform that brings together more than 1,500 neighbourhood level indicators in one place. And these are ready to be explored through interactive maps, dashboards and reports. And you can also add in your own data, so you can really tailor the platform towards your needs. So all of the data that we're going to be looking at today is readily available in Local Insight. So the agenda for today's session is I'm firstly going to give a little bit of context into the Left Behind Neighbourhoods project. I'm then going to do a bit more of a deep dive into the Community Needs Index and what it is. And I'm going to explore the characteristics and geographical distribution of the left behind neighbourhoods. And then lastly, I'm going to do a bit of data analysis into some of the key findings from the project, health outcomes and the Marmot social determinants of health as well. So firstly, let's look at the Left Behind Neighbourhood projects. So in 2018, Local Trust commissioned OCSI to develop a quantitative measure of left behind neighbourhoods. And Big Local is a programme funded by the National Lottery Community Fund and managed by Local Trust. And it was designed to reach deprived communities that had not historically received lottery money or public funding. And Local Trust's experience of this Big Local programme indicated that social infrastructure, and this is defined as places to meet, connectivity such as physical and digital, and community engagement were key determinants of the prospects of neighbourhoods. And the Community Needs Index was conceived as an attempt to measure some of these processes. So the index is the first of its kind. It maps community need at a hyperlocal level in a way that hasn't been done before. And because of this, it's a powerful tool for analysing and understanding spatial inequalities at the neighbourhood level and enabling comparisons between neighbourhoods. So the areas that rank in the top 10% most deprived on both the Community Needs Index and the Index of Multiple Deprivation are what we define as the most left behind neighbourhoods in England. So these are the communities which suffer from the highest levels of these combined economic and social deprivation, which is why we also refer to these areas as doubly disadvantaged neighbourhoods. So now we're going to have a little look at the location of these left behind neighbourhoods. So the original foundational research identified 206 neighbourhoods across England. We then updated this in 2020 to take account the changes to the index of multiple deprivation. So then this showed 225 wards which fell into this category. And these wards were largely concentrated in housing estates on the edges of our post-industrial towns and cities. So this includes Manchester, Birmingham, Newcastle and Liverpool. And also in coastal areas, particularly in the North and Midlands. And also there are areas to be found in pockets of deprivation along the south coast as well. And you'll see that there are very few left behind neighbourhoods in London and other city centres, and this is due to the kind of proliferation of social infrastructure in these areas, meaning that while they have significant problems with deprivation, they also have low community need as defined by our Community Needs Index. So the research found that left behind neighbourhoods perform poorly on a range of social and economic indicators in comparison to other similarly deprived areas, but these areas had stronger social infrastructure. So they were less resilient to shocks and started to fall behind other similarly deprived areas, as they tended to lack the civic resources and social capital to address and mitigate some of the challenges that they were experiencing. And this was perfectly illustrated during the COVID-19 pandemic, where people living in these left behind areas were 46% more likely to die of COVID-19, but where also they were receiving less than half of the national average levels of grant funding in response to the COVID-19 pandemic from UK foundations. So yeah, here's just a few of the results that we found in the first phase of the project. So you can see on these graphs as well that people in left behind neighbourhoods typically had poorer health and also were claiming more unemployment benefits as well. So we've recently updated the research by combining the 2019 Index of Multiple Deprivation with the newly updated Community Needs Index for 2023. And lower layer super output areas, so LSOAs, were identified as left behind if they ranked in the top 10% on both of these measures. So we used that same methodology as before, but with the updated Community Needs Index, which used LSOAs as the underlying statistical geography. 1,315 LSOAs are identified as left behind using this measure, and this encompasses over 2 million people. The spatial patterns are similar to the previous measure, so the highest concentrations are in the fringes of the metropolitan areas in the North and Midlands, and the coalfield and coastal regions as well. And so more than 10% of areas in the North East are identified as left behind. However, because the new measure is produced at a smaller spatial scale, it has uncovered a greater number of isolated pockets of high need. So this is particularly in the southwest of England, with a larger number of authorities outside of the major industrial and metropolitan areas containing left behind neighbourhoods. And in total, 156 local authorities contain at least one left behind neighbourhood. And so we have used the Community Needs Index and the Left Behind Neighbourhoods research in a number of ways. We presented the first iteration of the research to a group of MPs and peers who subsequently used the research as the basis for developing an evidence base for the all-party parliamentary group for Left Behind Neighbourhoods. So the MPs and peers formed the APPG to explore the needs of these areas and the aspirations of the residents to consider what could be done to meet these aspirations. Over the past 3 years, local trusts have been convening with the APPG and commissioning deep dive research into the left behind neighbourhoods data to examine specific issues such as health, transport, access to finance. And local trusts have recently published the report of the APPG inquiry into what's needed to level up the most left behind neighbourhoods. The Community Needs Index itself is also gaining wide usage. So, for example, it was cited as a measure of social capital in the Levelling Up white paper, and it has been used as a component in supporting the distribution of a range of Levelling Up programmes, including the Department for Culture, Media and Sport Know Your Neighbourhood Fund, while Sport England are also using the CNI as part of their targeting formula for their new £250 million local development partnership. So this research also helped local trusts to make the case for the Community Wealth Fund and to garner support for it as well. So this is a fund aimed at providing sustainable long-term funding for deprived areas, with the communities themselves determining the priorities for the spend. The research is also being used by local authorities and community foundations in a range of local research initiatives to highlight areas with high need that have historically been lacking in third sector investment. So some examples of local authorities using the Community Needs Index include Kingston upon Hull. So they've recognised that the majority of Levelling Up funding was targeting the city centre and have reorientated the shared prosperity fund into neighbourhoods that are identified as left behind. And Northamptonshire as well are using it to target some of their investment to developing green spaces in the 3 neighbourhoods identified as left behind. So now I'm going to give a bit more information about the Community Needs Index and how it was created and what the underlying data is. So the index incorporates community and social challenges which haven't been captured in the traditional deprivation metrics, such as the index of multiple deprivation. So these include poor community and civic infrastructure and low levels of participation and engagement in the wider community. So it's different from the index of multiple deprivation, as it's not so much about the presence of the bad stuff such as unemployment, crime, ill health, or wider economic or deprivation challenges. It's more about the absence of the good stuff. So we're looking at an active third sector, well-developed social networks, and strong presence of civic assets. So these things really support the social fabric of a place. And yeah, the index captures the absence of these. So there are 3 underlying subdomains that form the Community Needs Index, and each have their own underlying indicators. So you can see on the right here, we've got civic assets. So this is the presence of key community, civic, educational and cultural assets in a place. The second subdomain is connectedness. So this measures connectivity to key services, digital infrastructure, isolation and strengths of the local jobs market. And we also have active and engaged community. So that measures kind of the level of third sector civic and community activity and those barriers to participation and engagement. So the 2023 update to the Community Needs Index was produced at lower layer super output area level, so that's LSOAs. And we wanted to produce the index at a granular level in order to take into account the different and diverse needs of communities, which are often masked when looking at larger geographies, such as local authorities. And the selection of the unit of geography to use in a small area-based analysis is important because it affects not only the data that we can draw from, but also the focus areas that for intervention and resource allocation, which are identified as an outcome of the research. So yeah, the Community Needs Index is produced at LSOA level, and these are areas of approximately 1,700 people. And these were identified as the preferred unit of measurement for a number of reasons. Firstly, they only change after every census, so they're more consistent and a stable geography compared to the previously used wards. So even when changes are made following these census updates, these changes are capped, so there's a minimum of 95% of boundaries remaining unchanged. LSOAs are also designed to be fairly homogeneous in size, so you can compare similar sized areas to each other. They can be linked with other key measures, such as the indices of deprivation, which is also produced at LSOA level. They're also well used and popular amongst the user community. So we did run a consultation when updating the index, and 58% of our respondents stated that LSOAs were their preferred unit of geography for the measure. They're also a granular geography, so they can be used to support the identification of those pockets of need. And this is particularly important in those rural areas where there's generally smaller geographical scales and which are obscured in larger geographies such as MSOAs and wards, which can kind of encompass like multiple villages with very different characteristics. So yeah, very granular. As with all statistical measures, there are a couple of caveats as well. So similar to the IMD, this is a relative rather than an absolute measure. So you can compare how your neighbourhood performs relative to other areas. However, you can't say that one area is kind of twice as bad or half as bad as another. So the number itself is only meaningful in a relative rather than an absolute sense. This is also an area-based measure, so we are absolutely not saying that everybody in one area faces the same challenges. We're just saying that the concentrations of challenges are higher in that area. So I'm now just going to go on to look at the characteristics and the geographical distribution of these left behind neighbourhoods. So what do the results look like? So the map on the left here shows the average community needs score for 2023, aggregated to local authority level. So the local authorities are grouped into quintiles, where areas shaded dark blue are ranked in the 20% of local authorities with the highest needs. So as you can see, the highest concentrations can be found in the east of the country, particularly around the agricultural fen area, the Humber estuary, and the east coast, particularly around Lincolnshire, Norfolk and Essex, and former coalfield areas of the East Midlands, South Yorkshire and County Durham as well. However, it is important to recognise that the index is intended to be analysed at small area level, and so when we drill down to the neighbourhood level, we can see high levels of inequality within these local authorities as well. So, for example, the map on the top right here compares community need across the Greater Birmingham and West Midlands area. And you can see that there are high needs in the peripheral estates of the east of the city and parts of the Black Country as well, and lower needs in the area around the university and the prosperous suburbs of Sutton, Coldfield and Solihull. And evidence of inequality can also be seen when we focus in on East London, which is shown in the map on the bottom right here. So we can see need levels increasing as you travel further from central London. So the highest needs are in Rainham, Dagenham, Slade Green and Harold Hill as well. So this geographical pattern is reflected when we look more closely at the LSOAs with the highest community needs scores. So the table on this slide shows the LSOAs with the highest levels of community need. So these are the greatest social infrastructure challenges. And we can see that they're dominated by neighbourhoods in the east of the country and are typically found in peripheral housing estates in former industrial, agricultural and coastal communities. A number of local authorities have multiple very high needs, such as areas in Lincoln, Redcar, Hull, Wakefield and Stoke-on-Trent. And by contrast, the table on this slide shows the areas with the lowest levels of community need. And these are kind of overwhelmingly concentrated in the more affluent areas of London, particularly around Kensington and Chelsea, Hampstead, Highgate, Wimbledon, Richmond and Fulham. So now let's dig into the data a bit more. So I'm going to analyse some of the findings from the project relating to health outcomes specifically, and also specifically relating to the Marmot social determinants of health. So the Marmot Review was an independent study commissioned by government to explore the most effective evidence-based strategies for reducing health inequalities in England from 2010. The final report found that many people were dying prematurely due to health inequalities. It was found that these resulted from social inequalities, and that the lower a person's social position, the worse their health. So in total, between 1.3 and 2.5 billion extra years of life were lost due to these inequalities. So focusing on solely the most disadvantaged areas is not enough to reduce these inequalities sufficiently. But while most actions must be universal, this should be proportionate to the level of disadvantage, which is where access to this reliable small area data comes in handy. So the Marmot Review argues that reducing health inequalities will require action on 6 principles to address the social determinants of health. And the successful delivery of these objectives will depend on action from a range of both national and local stakeholders. So these include central and local government, the NHS, third and private sectors, as well as community groups. And social determinants of health are the non-medical factors that ultimately influence health outcomes, either positive or negatively. So they're the conditions and systems that shape the context of daily life, and this can refer to things such as the social, cultural, political, economic, commercial, and environmental factors that we operate in. So I'm going to talk through some examples of social determinants and some data sets which can identify the most disadvantaged areas and show how those neighbourhoods classified as left behind fare worse on these measures compared to neighbourhoods which are deprived but not necessarily left behind. So the first Marmot Principle is give every child the best start in life, and the review suggests that we need to reduce the inequalities in the early development of physical and emotional health and cognitive, linguistic and social skills. So in this slide, I've analysed the measure children aged 0 to 19 in relative low-income families as a proxy to identify whether neighbourhoods classified as left behind fare worse on this principle in comparison to the national average, as well as in comparison to other deprived areas, which kind of score highly on the index of multiple deprivation but don't have the dual disadvantage, and so therefore they're not classified as left behind. So in this measure, relative low income is defined as a family in low income before housing costs. So the family must have claimed one or more of universal credit, tax credit, or housing benefit at any point in the year in order to be classified as low income. And a rate is calculated by dividing the number of children aged 0 to 19 in these low income families by the total number of children aged 0 to 19 in the area. So if we look at the graph on the left here, which compares the proportion of these children in left behind neighbourhoods, deprived areas, and the England average, we can actually see that although both deprived areas have significantly more children in poverty compared to England as a whole, left behind neighbourhoods actually have a lower proportion of these children in comparison to their deprived counterparts. So we can see that just over a third of children in left behind neighbourhoods are living in low income families, compared to almost half in deprived non-left behind areas. However, if we then turn our attention to the graph on the right, I've further analysed this data by looking into the proportion of these families which are lone parent families. So this means the parent guardian has had no partnerships at any point in the year, and also looking at out of work families. So these are identified as those which have not had an accumulated period of at least 26 weeks paid employment in the year. So we can see that in left behind neighbourhoods, children living in these families make up a larger proportion of the overall amount of children living in these relative low income families in comparison to deprived non-left behind neighbourhoods and the national average. So for example, children in low income and low parent households on the left here make up nearly 60% of relative low income families in comparison to areas without the dual disadvantage, where these families make up just over 45%. So this shows that these areas considered left behind are faring slightly worse in terms of children having multiple challenges, really honing in to the inequalities that exist with this social determinant of health. The second Marmot Principle focuses on enabling all to maximise capabilities and control their lives. So this suggests that we need to kind of reduce the social gradient in skills and qualifications, and improve the access and use of quality of life learning. And so in order to analyse this, I've looked at levels of qualifications in left behind neighbourhoods, their deprived counterparts and England as a whole. And these are all self-reported measures from the 2021 census, which ask people what their highest qualification is. So as you can see in the graph on the left here, there is a clear gradient in qualification levels across all areas, with left behind neighbourhoods having the highest proportion of people with no qualifications, so almost 1 in 3 individuals aged 16 plus, and also the lowest proportion of people with degree or higher qualifications at 17.6% here. This is relative to comparator areas, so we can see that we're over 1 in 3 people in England are educated to this level. Again, this really shows the inequalities that exist across the country and supports the suggestion that we need to develop and deliver interventions to improve health equity. I've also included a table on the right here which shows the 10 left behind neighbourhoods with the highest proportion of people with no qualifications. And we can see that neighbourhoods in Middlesbrough, East Lindsey and Tendring show high levels of no qualifications. So again, kind of dominated in the east of the country, typically in peripheral housing estates in those former industrial, agricultural and coastal communities. So the third Marmot Principle is create fair employment and good work for all, and this suggests we need to kind of improve access to good jobs, reduce long-term unemployment, and improve the quality of jobs, making it easier for people who are disadvantaged in the labour market to obtain work. So here I've looked at levels of youth unemployment between 2016 and the latest data from the last month in June. So this shows the proportion of people receiving job seekers allowance or universal credit for those who are out of work, aged 18 to 24. So this is presented as a proportion of all 18 to 24-year-olds. So as we can see, currently left behind neighbourhoods show a higher proportion of youth unemployment relative to their comparator areas. So almost 12% of 18 to 24-year-olds are claiming unemployment benefits here. And this is over double the national average, which is just over 5%. And we can also see that all areas follow the same pattern over in youth unemployment over this time. So there's a sharp rise during the COVID-19 pandemic here. And interestingly, all areas actually are still showing higher unemployment rates than pre-pandemic levels as well. So this still hasn't settled down post-pandemic. The fourth Marmot Principle is ensuring a healthy standard of living for all, and this suggests that we need to kind of establish a minimum income for healthy living and reduce the social gradient in the standard of living as well. So here I've looked at fuel poverty as a proxy measure for healthy living, and this is defined based on the low income, low energy efficiency fuel poverty metric, where a house is considered fuel poor if it's living in a property with an energy efficiency rating of D or below, and also if its disposable income is below the poverty line. So in this chart I've shown the 10 left behind neighbourhoods with the highest proportion of households in fuel poverty, and I've compared it to the average across all left behind neighbourhoods and the England average as well. So this really highlights the disparity between neighbourhoods, with these 10 neighbourhoods here having much higher proportions than the average across all left behind neighbourhoods, which are already the area of focus. So we can see here almost half of all households in this neighbourhood in East Riding of Yorkshire are considered to be in fuel poverty. And again, it's these neighbourhoods on peripheral housing estates in the northeast which are faring worse here. And fuel poverty is just one proxy of healthy living, but you could also look into things such as distance to food services, overcrowded housing and lack of central heating as well. The third Marmot Principle is create and develop healthy and sustainable places and communities, so Paul's favourite. And this suggests that we need to develop common policies to kind of reduce the scale and impact of climate change and health inequalities, and also improve the community capital and reduce the social isolation across the social gradient. So this is an interesting one because it kind of directly relates to the Community Needs Index, of which I explained earlier on. So here I've analysed the index along with its subdomains for left behind neighbourhoods, deprived non-left behind neighbourhoods and England as a whole. So the index is represented by scores, but these scores are then also transformed into ranks, so then we can easily compare this across areas. So here a lower rank indicates that an area has higher levels of need. So we can see that overall left behind neighbourhoods rank much lower on the index relative to other areas, and they also have lower ranks on all 3 of the subdomains on the index too. So this really highlights that these neighbourhoods are suffering from a lack of community capital and social connection, alongside a lack of assets and social infrastructure as well. So this really represents the purpose of the Left Behind Neighbourhood study, as we can see here that the other areas which are highly deprived, but they still have places and spaces to meet, connectivity and engagement, which boost their community. And so we can see that they're ranking higher than these left behind neighbourhoods, as they don't have that dual disadvantage here. And finally, Principle 6, so this is strengthening the role and impact of ill health prevention, suggesting we need to kind of prioritise the prevention and early detection of conditions most strongly related to health inequalities. So here I've looked at two measures, and the graph on the left looks at the proportion of children in reception year, those aged 4 to 5, classified as obese, and data is collected from the National Child Measurement Programme. So this is a good measure of ill health prevention, and we can see that left behind neighbourhoods have a higher proportion of children who are classified as obese at this age in comparison to other deprived areas and the national average. And we can also see that this trend is mirrored in the measure on the right here as well. So this looks at the proportion of adults who are physically inactive, and this is defined as doing less than 30 minutes of activity per week. So we can see that left behind neighbourhoods also have higher proportion of physically inactive adults in comparison to other deprived areas and the national average, with an average of almost 1 in 3 adults being classified as physically inactive in these areas, compared to just under a quarter nationally. Again, this highlights the inequalities in social determinants of health and the need to prioritise the prevention and early detection of ill health, and also increase funding in ill health prevention across this social gradient. And finally, I just wanted to highlight a few measures of health outcomes. So now we're looking at the kind of consequences rather than the Marmot social determinants. And so we can see a clear relationship here between poorer health outcomes and those neighbourhoods which are dually disadvantaged. So in the top left chart here, we can see that left behind neighbourhoods have a higher proportion of residents aged 65 plus with a limiting long-term illness relative to these comparator areas. And this trend has persisted over the 10 years from the 2011 census to the 2021 census. And looking at this table at the bottom of the slide, we can also see that a 2021 census measure which asked residents to self-report their general health also showed that a higher proportion of residents in left behind neighbourhoods reported their health to be bad or very bad. So we can see that just over 7% of residents in left behind neighbourhoods would say that their health is bad in these areas, in comparison to just over 6% in other deprived and nearly 4% nationally. And finally, in the top right chart, you can see a couple of measures of healthy life expectancy. So this is the average number of years that an individual might expect to live in good health in their lifetime. And although this is a local authority measure, we can see that both males and females, local authorities which contain at least one left behind neighbourhood, have a lower healthy life expectancy in comparison to other deprived areas and England. So that was a little quick whistle-stop demo of some of the kind of analysis you can do when looking at neighbourhood level data on health inequalities. So I hope you found it useful to see some example visualisations I've pulled together to draw out some conclusions of where the attention should be focused on when trying to reduce these inequalities. So as I mentioned before, all of the data we have explored today is available in our data platform, Local Insight, and this is ready to explore for any area you're interested in through interactive maps, dashboards and reports. And if you'd like to find out more about Local Insight, please either drop Kim an email at kimberly.gregory@ocsy.co.uk or book a demo through the website, so you can book a free personalised demo and a 2-week free trial. And finally, I've just added a few links here for further resources, including a recent blog post we pulled together that suggests neighbourhood level data you can use that is aligned with the Marmot Principles, as well as the technical methodology paper for the Community Needs Index, which looks at the underlying indicators which are included in each of the domains. So yeah, I hope you found that useful, and I'll pass back to either Paul to answer some questions. I know I've seen we've got a lot of questions in the chat, so I'll have to take my time to have a read through them before I answer anything.
Okay, thanks, Katie. I mean, I find that really interesting. Whilst people are thinking of questions they might like to ask, and please raise your hand if you have got a question. There's one thing I'd like to ask, which is about the granularity of the data. I mean, I live in my authority. We don't have any left behind neighbourhoods in our authority, but we know that there are neighbourhoods that are particularly disadvantaged. How would a local authority say, well, we know that we've got neighbourhoods of maybe a few thousand people. that we should be investing, how would they identify them?
Identify left behind neighbourhoods, or just kind of
well,
disadvantaged?
how would they identify them based on Marmot's principles? How would they identify those neighbourhoods for development, if you like, or for investment, or for support? Yeah.
Yeah, so a lot of the data I've spoken about today is available down to that granular level. So the first thing to do would be to just kind of like look at all these health measures that are available out there, and maybe pick out the top 10 areas that like kind of score highest or fare worse on each of the measures. And you could then, using that, kind of build up a story of the areas that need that kind of intervention in the area.
Okay, thank you. Do we have any questions from the audience?
I'll just jump in on the Q&A. There was a question here from Lindsay that says, how do we access the neighborhood level list? I think that Kim was kind of jumping in and out of the chat trying to answer some of these questions as well. But I don't know, Katie, if you could speak to that, how they might be able to access that.
Yeah, we've got a blog post on our website, so Kim has put the link in the chat. So yeah, the blog post looks at lots of underlying data sets that are available down to that granular level, and it looks at them for each of the Marmot principles. I've just seen, I think we can look at updating it so it includes principles 7 and 8. Currently it doesn't. It includes 1 to 6, but yeah, there's a full list on there which includes the sources and how often the data sets are updated as well, so you should be able to easily find them. But as I said, they're all available on the Local Insight platform if people were interested in that as well.